Prediabetes is a medical condition where blood sugar levels are higher than normal, but not high enough yet to be considered diabetes. According to the CDC, approximately 98 million adults in America, meaning more than 1 out of 3 adults, have prediabetes. And of those people with prediabetes, 80% don't even know they have it. Prediabetes puts you at risk for developing full type 2 diabetes, heart disease, and even stroke. Modern scientific breakthroughs in pharmacology have provided many breakthrough medications that can improve health. And you may have seen many of these advertised on TV. You will also have noted that many of these medications come along with a laundry list of serious side effects and potential risks. The objective of this video is to compare the effectiveness of lifestyle changes such as exercise to pharmacological agents, medications, to help prevent the progression and incidence of developing type 2 diabetes. Hi, I'm Dr. Edmond Cleeman. I'm an orthopedic surgeon here in New York. I specialize in sports medicine and arthroscopic surgery. Several studies, including meta-analyses, have demonstrated the superior benefit of lifestyle changes, including exercise, to prevent diabetes. About 20 years ago, there was one such study that was published in the New England Journal of Medicine, which showed the superior benefit of lifestyle changes such as exercise to prevent the development of type 2 diabetes in pre-diabetic patients. In this study, they looked at 3,200 people, average age 51 years, and about 45% of them were members of a minority group. And in this study, they randomized people to either a placebo group, a medication group called metformin, and a lifestyle modification program where people did 150 minutes of exercise of moderate intensity, such as brisk walking. The results after 3 years, they found that almost 30% of people in the placebo group went on to develop diabetes. In the medication group, about 22% ended up developing diabetes. And in those doing the lifestyle intervention group, meaning the exercise group, only 14% ended up developing diabetes, so a significant difference. Now, comparing treatment versus placebo, the lifestyle intervention, the exercise group, had reduced the incidence of developing diabetes by almost 60%, versus the medication group, which reduced the risk by 30%. So a significant difference. And when you compare the exercise group to the medication group, the incidence of diabetes was 40% lower in the exercise group compared to the medication group. There are several meta-analyses that corroborate these findings. One of these looked at 32 randomized controlled trials comprising of over 43,000 patients. And they found that in adults with prediabetes, that the lifestyle modification group, meaning the ones that were doing exercise, had reduced the risk of developing diabetes by 40%, and the medication group, the metformin group, had reduced it by 27%. So here again, there are meta-analyses that corroborate the findings of that initial study. Unfortunately, many people who have diabetes will go on to develop many other adverse health events. And studies show that by performing a lifestyle change can also help reduce the development of some of these adverse health events. So in another study that looked at the same population of people from what we discussed before, again, 3,200 people with prediabetes, the researchers were able to show the difference in estimates of developing some of these health problems. For example, in those who did exercise, they reduced their incidence of developing blindness by 40% versus a reduction of only 16% in the medication group. For developing end-stage renal disease, exercise reduced that risk by 38%, whereas the medication reduced that risk by only 17%. The risk of needing an amputation was reduced by 35% in the lifestyle change group versus only a reduction of 16% in the medication group. Stroke was reduced by 9% in the exercise group and only by 3% reduction in the medication group. And coronary heart disease was reduced by 8% in the exercise group and only by a 2% reduction in those with the medications. So here's another study showing some of the superior benefits of introducing lifestyle changes such as exercise to reduce many of the serious side effects that can come along with diabetes. Insulin is a hormone made by the pancreas, and it signals cells in our body, like our muscle cells, to take up the glucose, the blood sugar, from our bloodstream. Now, insulin resistance is when the cells don't respond so well to the insulin, and so therefore can't take up the glucose so well, and then insulin levels may rise in the blood. And this is often seen in people who have a poor diet or in people who have increased amounts of visceral fat. And prediabetes often occurs in people who already have some insulin resistance. On a positive note, there are studies that show that exercise can help improve insulin sensitivity. For example, there was a study of prediabetic patients, and they were randomized into either a placebo group, a medication group called metformin, a group that did exercise training, or a group that did exercise training plus took the medication. And the exercise group was for 12 weeks, and people exercised 3 days a week for about 60 to 75 minutes per session. And this exercise included both aerobic and resistance exercise. And what they found in this study relative to the placebo group, that taking medication, doing exercise, or doing exercise plus medication, all enhanced insulin sensitivity. But interestingly, there was no significant difference between the 3 different intervention groups, meaning they all seemed to work just as well, meaning exercise worked just as well as taking medication. And they found that the fasting insulin concentrations were lower, about 13 to 25% lower after these 3 interventions. So what the study shows was that both exercise and medication both improved insulin sensitivity, as seen by lower concentrations of insulin in the body. But the advantage of exercise is you don't have the cost of taking medication, and you don't have the side effects potentially from medications. Let's wrap up this video and go over a few key points. Number 1, prediabetes is a very common health condition in the US. Number 2, both exercise and medication can help reduce the risk of developing type 2 diabetes. Number 3, exercising at least 150 minutes per week seems to be more effective in reducing the risk of developing diabetes in prediabetic patients than even medication. And number 4, if you do have prediabetes or diabetes, you should consult with your physician for the best treatment plan. Thanks for watching this video. I hope you found it helpful. If you did, please click the like button below and subscribe. I look forward to seeing you in my next video or in my office.